Colleagues and friends, I feel incredibly lucky. I have been so lucky to have known such a fantastic, wonderful person as Aubrey was. When we first heard that Aubrey was no longer here, I realized that I was not the only lucky person. We are so many, incredible many people who have benefited so much from having known a person like Aubrey. I was so lucky to meet Aubrey already back in the 70s, so have known Aubrey and Helena for more than 40 years. It's a very long time, and Aubrey has meant so much for me in every ways. In my career, in my private life, in where I have been, in just every levels, every ways. So to say something about such an important person to you in 8 minutes is nearly impossible. It's been so difficult to find out what I should say. So I'm afraid for this occasion I have chosen maybe also to be boring, like Tim Lang said he was going to be earlier today, that I have written down so that I wouldn't rattle on, but really pay respect and give honor to Aubrey's work and all the things he has done. So that's what I'm going to do. Aubrey was truly an international public health advocate. Not merely that, he was a giant in dental public health. Back in the 70s, as a PhD student in Copenhagen, I was so lucky enough not only to hear and read about him, but got to be invited to come to London and work with him in my first PhD years between the before and after study. Aubrey was in every way a totally unique and incredible person. He was a man with a big intellect, years ahead of his time, especially scientifically, but also in many other ways. In addition to all his scientific work, publications and other writings, he taught and supervised hundreds of PhD students, master students, health professionals from all over the world. A large group of Aubrey's previous students are now occupying positions such as deans, heads of departments, professors, or chief dental officers in almost all parts of the world. Many of us are frequently communicating and networking, and often we have arranged to meet up in connections with IADR meetings where Aubrey and his wife Helena would participate if possible. He was such a generous, warm and courageous human being who with great enthusiasm engaged himself in all colleagues as well as students with such energy that there was always room for everyone, high or low. Aubrey was interested in the issue, making things better, developing and equipping the world with the tools of equity to create health and fairness. Never did we hear him raise his voice in an audience or in any audience in order to promote himself. It was indeed very typical of Aubrey and Helena that it recently was announced or published that they donated millions to dental research and education in South Africa. Aubrey was a truly giant in the sphere of dental public health. He contributed to the scientific community immensely, publishing in excess, as you already heard, of 400 peer-reviewed articles in Medline indexed journals, in addition to a multitude of scientific presentations, policy reports, books and book chapters over a period spanning 6 decades. His research, as well as his audience, involved diverse population groups from all corners of the world. Aubrey's scientific output is actually so extensive and so wide-ranging that it simply can't be categorized in a straightforward manner. A closer look at the contributions reveals that he began publishing regularly in the 60s. Many of his earlier publications focused on the epidemiology of all diseases in Africa, Britain, and North America. Aubrey then gathered extensive evidence to publish a seminal article in The Lancet in 1977, which made him both famous and also controversial. In this article, he demonstrated through evidence on key oral disorders that there is no scientific basis for a 6-monthly dental examination, thereby questioning the need for spending public resources for such endeavor and recommending recalls at 12 or 18 months intervals instead. It was after this publication that Aubrey got the nickname "A Necessary Pain in the Neck," of course mainly by those who opposed his views. He didn't care about that. In 2006, Aubrey and his co-workers reassessed the recall frequency intervals for dental examination in low caries incidence populations and recommended that yearly dental examinations interval be extended to 2 yearly intervals or longer in order to improve resource allocation to those with greater needs, thereby reducing inequalities in oral health. And indeed, inequalities in oral health is probably the area in which Aubrey made his most important contributions in the dental literature. So much so that the field simply cannot be studied without exploring his enormous contributions. He published prolifically in this area, including producing several seminal articles, such as the one in the British Dental Journal in 1999, in which he and his co-author Richard Watt reviewed the evidence on inequalities in oral health and provided recommendations for action to reduce such inequalities. In other pivotal works, he proposed a common risk factor approach and its integration into social determinant framework for promoting oral and general health. Within the area of oral health inequalities, he covered broad-ranging topics such as cross-national analysis of social gradients in oral health, associations between oral diseases and social deprivation and income inequality, relations between social networks, social support, and dental caries, and the various influences of neighborhood and individual social capital on oral health-related quality of life. He was part of the Global Oral Health Inequality Task Force established by the IADR. He was also a major inspirational supporter and helper for the establishment of both the Global Oral Health Inequality Research Network, the GOHIRN, and the International Centre for Oral Health Inequalities Research and Policy, here from London. Since the early 70s, Aubrey began documenting the effect of dental education and evaluating the effectiveness of dental care, designing and delivering effective health promotion programs, and assessing the dental treatment needs and demands and the manpower implications of such needs. He took the issue of sugar and dental caries head-on, presenting another seminal article in The Lancet in 1983, in which he outlined goals for sugar consumption to prevent dental caries and presented policies and measures needed to achieve these goals. In a report published by the IADR entitled Diet and Dental Caries, the pivotal role of free sugars re-emphasized, Aubrey concluded there is extensive scientific evidence that free sugars are the only crucial factor that determines the development of dental caries. His dogged pursuance of this topic saw him produce several other publications reappraising the quantitative relationship between dietary sugar and dental caries, challenging existing WHO goals for sugar intake, and lobbying for dental need for developing newer goals for reducing sugar intake, reformulating food products, enhancing the labeling of foods, establishing taxation to sugars or on sugars, and educating the public and healthcare professionals in this area. His final publication, an insightful one as usual, appeared in the Journal of ADA in December 2015, in which he called for increased attention on the global burden of oral diseases, their negative social and economic effects, and a new population-based model for promoting oral and general health. Throughout his career, Aubrey introduced several new methods, measures, and indicators in various aspects of dentistry, including new composite indicators of dental health, caries scoring system, and methods for analyzing caries progression data, socio-dental measures of dental impact on daily living. Indices of eating difficulties, screening and treatment needs, and strategies for improving oral health and reforming oral healthcare systems. I could just go on and on and on. It really is incredible. There has never been anyone like Aubrey, and there never will be. The worldwide dental professions and the public health community owe him an enormous debt of gratitude for his colossal contribution. Aubrey was, after all, only a human being, and as such, no longer with us. We shall no longer hear his voice in real, but he has planted his seeds, made hundreds of followers, and we will continue to raise our voices as best we can. All of us who have been so lucky to have met and to have known such a wonderful and generous person. Thank you.